so I am working with somebody who had actually contacted me, not even realizing that I was in school for this. And she said, please help me get off of smoking. So this is about Karen, and she wants freedom from tobacco. She's a 54-year-old female. She has anxiety, and she was smoking up to 2 packs of cigarettes a day, and she keeps no less than three cartons of cigarettes in the home at a time. She says it helps her with anxiety and pain and energy. So I told her about what I was doing, and she agreed to, obviously it's a really good deal to come on as a student. And she said yes. So she said, she showed me her medications. They're for hypertension, pain, muscle relaxation, and she actually smokes 2 cigarettes sometimes at a time. So the first thing I wanted to do was I wanted to take a look at her medications. I did send her the forms, and I'll show you those in a moment. But these are her medications that she takes, and you can see they're for muscle relaxation, anxiety, blood pressure, pain, and anemia. She doesn't always take the muscle relaxers, anxiety, and pain. They are as needed, but she finds that she needs them often. And these are her supplements.
Excuse me, how often is she taking her opioid?
She said that she was taking it just whenever she felt like it, but sometimes it could be, like maybe, 2 or 3 times a week, not necessarily in a day.
Sure.
And then her supplements are just whatever she bought on sale at Kroger. And so we went through them, and I did a cabinet clean out. Told her, some things are not absorbable, some things she doesn't even need. I asked her why she bought certain things. She just read that they were good for her. And I said, well, we're not going to do that anymore. So we cleaned out a lot of stuff.
Good for you.
So one of the things I wanted to talk to her about is because when I was talking with her, I noticed that there are a lot of things that while we are doing the clean out, and while we are getting prepared to put different supplements into her home and into her body, I talked to her about some other things that she can do. And I just talked to her about her real need to deep breathe. While you're inhaling, your body actually needs to do the deep breathing. So I just talked to her about deep breathing. How do you deep breathe? And I talked to her about the exchange of gases that take place in the lower lobes of the lungs.
Right.
And this one is, I shared this with her just in case she didn't realize what actually was in a cigarette. I let her know about all of these toxins. There's over 4,000 carcinogenic chemicals in tobacco. You could take a look at them. I'm not going to read them or anything, but.
Ouch. Ouch.
Karen is a Christian, and one of the things that I used to do was I used to facilitate a 12-step recovery. So I took this opportunity to talk to her about not trying to quit. Sometimes when we try too hard, we get anxiety, and that actually kind of perpetuates her cycle. So I told her I want her to stop trying to quit. And I want her to just hold those up to God daily. Remember, this is bigger than she is, but not bigger than he is. And I gave her some verses that I wanted her to just affirm on a daily basis.
Excellent, because that's addressing the third leg of the stool,
the spiritual component.
Very good.
Okay, so here are her amino acids. She came to me in the beginning of June, and we just kind of talked about a few things, but it was a slow start in the beginning with all of the cabinet clean out. Money's an issue for her. And I find it ironic that money's an issue for her, but yet she keeps no less than 3 cartons of cigarettes in the home. Okay, so we kind of talked about that, and I had to just tweak that a little bit. But so as you can see, she's kind of high in all of them, but the highest ones that I saw was in the endorphin and the GABA. I really wanted to talk to her a little bit about her endorphins, but I was concerned at the time that because of her high blood pressure, I couldn't put her on anything. But then I remembered the DPA, and I talked to her about the DPA, but she had to get that through Amazon, and it took her from June 1st till last week to get the DPA, but she finally did it, and she's starting on it this week.
Darlene, you know, people can order it off the website, off my the Academy, at the vitamin store and the Academy website.
Yes, I do know that she had chosen to order it off Amazon.
Sure.
But she just didn't until
I get it.
last
Okay,
week.
fair enough.
Okay. So let's see. Down here on the left-hand side at the GABA, I had asked her to go ahead and get GABA and just start slowly at 100 milligrams because I don't want her to keep on chewing them throughout the day, but I wanted her to kind of start slowly and see what her limit was without getting overexcited. And she could keep going, actually. Every time she had a craving, she would grab for a GABA, but not, well, I shouldn't say every time, maybe about up to 5 times or 6 times a day, she would grab for a GABA, and she does work. So that kind of helped. But even during her break times at work, she would literally put one cigarette in one hand and another cigarette in another and do this. But she did say that the GABA was helping her. And let's see, we didn't start her off with theanine serine yet until maybe about a month after she was doing the GABA, because there's a lot of GABA already in the theanine serine. So for the first month, she was just on the GABA and working on getting her cofactors in place. So this was her suggested protocol. When she finally got the DPA, you know, she just started this week, but I had talked to her about it over a month ago. 500 milligrams in the morning, 500 milligrams at noon, GABA 100 milligrams each time she wanted to smoke. And so she started slow, didn't go over 500 milligrams. And then theanine serine, she was going to take 2 of them on the way home from work, because that's when she felt the most anxiety, and then 2 before bed. And then her cofactors, we got her up to about 2,000 milligrams of the omega-3s, Nordic Natural. I told her about the True Balance multivitamin because they seemed to be better for diabetes, and she doesn't have diabetes, but I was sensing that she did have some kind of maybe insulin resistance in talking to her. And I also found out, I didn't write it down, but I also found out while doing this that you could actually deplete, for every cigarette, you deplete 25 milligrams of vitamin C. So I told her that for every pack of cigarettes, she actually needs about another 500 milligrams of vitamin C. So I told her that I want her to start at about 2,000 milligrams of vitamin C, but to bring it up to bowel tolerance. So 500 milligrams each time. And bowel tolerance is some people can handle a lot more. Some people can only handle maybe 3,000 without having cramping. So you increase it by 500 milligrams until you get some cramping. And when you get cramping, stop, try it again the next day, try to see if you could bring it up, and just keep going until you have your loose stool. If you have loose stool, just stop. And then she's on a prescription vitamin D2 at 50,000 with a protein shake. I haven't gone into too much detail about her eating. I just talked to her about having some higher protein and higher omegas. But because there's a lot of things that she's actually having to look at, I'm going to, if she allows me to do this, I'll talk to her about nutrition soon.
Darlene, can I ask you a quick question?
Yes.
The cofactors there, are those just general, or I know you mentioned the vitamin C compensating for the depletion from cigarettes, but the other ones, are those general, or those specifically help with assimilation of the aminos?
Those are actually general, what she was taking. The Nordic Naturals, I had her on at 2,000 because that's where I wanted her to start. She was pretty much taking very minimal amounts in the beginning. So I just wanted to kind of bring her up to basic, and then
Okay.
we can talk about something later.
But those aren't essential for the assimilation of the aminos.
I think they are. Yeah, the
Oh, they are.
omega-3s, the omega-3s definitely. Okay.
But which amino acid would the omega-3s help with?
Okay, so Dylan,
Yeah.
the omega-3s are an important component in energy production, in as anti-inflammatories, and in the transmission of neurotransmitters by being in the neuron cell wall.
Oh, so they'll help with any amino, pretty
So
much.
they help with all the aminos
All
because
the aminos.
they help with amino transmission
Okay, got it.
or neurotransmitter transmission. And
Cool.
because they are part of energy production, for anything to happen in the brain and body requires ATP, requires energy. And so the omegas are also supporting that energy production that runs everything.
And is that omega-3, 6, and 9, all of them, or just certain omegas?
Well, the specific omega-3s, and then there's some other fatty acids that do as well.
Okay.
But
when we're prescribing aminos here for this purpose, you're mainly doing omega-3s, right?
Yes, we're doing omega-3s because we assume that people are getting the other fatty acids in a regular diet.
Oh, but 3s, they normally wouldn't, they might not be.
3s, the consumption in the Western world over the last 100 years has dropped by 80%.
Oh, okay.
Okay, so most people are getting 80% less than what they need.
Wow, okay.
Okay, that's why we supplement with it. And the 2 grams is really just a maintenance dose. But it's certainly better than nothing. And for some people, it makes all the difference in the world. But Dylan, the other reason we bring in the omega-3s is because it decreases inflammation.
Okay.
And inflammation decreases the ability of the amino acids to be converted into the neurotransmitters.
Can you say that one more time? I'm writing this stuff down.
Okay. BH4 is a chemical that is required to turn tyrosine and 5-HTP into their neurotransmitters.
Yeah.
And BH4 gets depleted by inflammation. Fish oil is anti-inflammatory.
Okay.
Okay. And therefore antidepressant indirectly.
Okay. Yeah. So inflammation affects the neurotransmitter transmission or creation?
Creation.
Creation, okay. Got it. Thank you.
Yep.
I remember what you had said very early on, that omega-3s are the train to the brain. And there's just a number of seats on the train. And so I just always keep that picture in my mind that that omega-3s are always the number one cofactor that you need to carry the other supplements, the other nutrients to the brain. There's limited seats on the train. And if you have carbs and protein gets kicked off if there's too many carbs. So
Okay.
that's what.
And most people are 80% deficient in omega-3s?
In the omega-3s, yep.
Wow.
Because we just don't get it in our food the way we used to.
Wow. Okay. Yeah.
You know, most people don't eat wild game, don't eat cold water fish, don't eat walnuts, don't eat a ton of dark green leafies. Yep. Right? These things are just not a normal part of our diet.
Yeah. Yeah.
Yeah. And when we eat eggs, we usually eat the cheap eggs that aren't very high in the omega-3s. So it all adds up in the wrong direction.
Okay.
Yeah. Okay, go on.
Okay, so I just did a follow-up with her and just to have these really quick timeline here. July 25th, she was she was aware of when she actually got anxiety in the morning and after work. Those were the most stressful times. She takes GABA for those. And at that time, she was keeping less than 2 cartons a day in the home. On August 1st, she got frustrated that she wasn't quitting fast enough. So she ran to the doctor and asked for a prescription to stop smoking. And so she said that she would still try to get, at that time, she was still going to try to get the DPA. And she still wanted to work with me because I asked her, I said, well, do you still want to go ahead and as planned with me then? She said, yes. But then on August 8th, a couple days ago, this past Sunday, she just told me she decided not to do that. She wasn't going to get the prescription. She finds her anxiety is decreasing. She does take the theanine serene after work, and she dismissed the prescription to stop smoking. And she told me she had just under a carton left and didn't buy another. So on Saturday, she told me she didn't start the DPA. She was starting it this Monday, but she needed something to do with her hands. So I told her, get the squeeze balls so she can have something to do with her hands.
Nice. That's smart.
And then this is just her chart from, June, July, and August. So she was smoking 2 packs of cigarettes a day in June, got down to just under 2 packs in July. Now she's just under a pack a day as of August 8th. I asked her to rate her anxiety level. So the blue is June, the yellow is July, and August. She is at a 4. And her cartons on hand in June was 3. Then it was just under 2. And now it was, she had, let me see, what was it, like 5 or 6 packs of cigarettes, and she did not buy another carton. So we're making progress.
Oh, you're making enormous progress. Do you have a follow-up amino acid therapy chart?
Not yet, I don't. I will get one.
Okay, because as soon as you present that, then we can consider this a closed case, even though you're going to continue working on her.
Okay, I will get that follow-up amino, follow-up. I'd like her to start the DPA, I think, and be on it for a little while. And she said she was starting it this past Monday. What's today, Wednesday? She said she was starting it Monday, so maybe hopefully next class I'll have one.
Good, good. I think that'll make a huge difference as well. One of the tricks I use when people are really ready to decrease the number of cigarettes they smoke a day is, while she was starting with smoking 2 cigarettes at a time, hopefully she's down to 1 at a time. I then have people break their cigarettes in half and only smoke half a cigarette at a time rather than the whole thing,
Okay.
because
And
that's doing a slow taper.
I forgot to tell you that she also bought her last carton, she bought the light cigarettes as opposed to her regular. So
Yes.
I forgot to put that down there. But yes, half a cigarette, that's another discipline. So it's like with this, it's like there's so many different components. It's not just a matter of nutrition. She's got to change how she thinks. She's got to change some behaviors. She's got to have a substitute for what she does with her hands, what she does when she sits, when she's bored, what she does at home, what she does when she's driving. She has to have something different because those things she just does absent-mindedly. So,
right. But Darlene, that's true for every single addictive disorder. Okay, this is why we have the three-legged stool, right? I never ever say that nutrition, that it's a one-legged stool, and that brain food is going to fix the entire problem.
right.
We really have to address the whole entire picture more or less at the same time. And so I love the way that you're doing that with this client.
Thank you.
Yeah, very good.
Okay, that is it.